Hello and welcome back to the Bright Light Wellness YouTube channel and also the Healing with Homeopathy Substack. I'm recording this for both of these platforms. If you don't know, I have a Substack called Healing with Homeopathy where I teach a lot about homeopathy there. It's just homeopathics focused, and I also have like exclusive content for paid subscribers and hoping to like be expanding that, doing Q&As and really like deep diving into like specific remedies or specific topics that you want me to deep dive into. So keep me posted on what you want to know more about. And if you're just finding me on YouTube, head over to that Substack as well. It'll be linked in the show notes below. But yeah, let's get into what the topic is today. It's going to be about another acute remedy that you can use. This remedy can be used acutely or chronically, but it's typically, I see it more useful in acute situations. And this remedy is Ledum or Ledum. Some people say Ledum, some people say Ledum. Anyway, it's a plant remedy. And it's a really great acute remedy to have on hand for certain situations. So I actually just used Ledum recently in my home, and this is why I wanted to talk about this remedy today on my YouTube and on the Substack, so you guys can know how to use this remedy for yourself. So Ledum is a good remedy for puncture wounds, bites, stings, insect bites, things like that. We think of Apis typically as well, which is made from the honeybee for these kind of situations. And I'll do a separate video on Apis talking about when you would use that remedy. But Ledum I used recently for my dog. He gets bit by ticks so frequently, but he doesn't usually have any ailments from it. He's usually just fine. So then I don't really treat it because if there's no symptomology, like okay, if you get bit by a tick and you have symptomology afterwards, then you want to support it. If you get bit by a tick and you have no symptomology, you don't need to support it. But some people will say, oh, use Ledum, whenever you get bit by a tick, to make sure you don't have any adverse reactions like developing Lyme disease. I'm not really sure about that, but because that my dog would have had like 50 doses of Ledum by now, and that probably wouldn't have been a good thing. However, he was recently bit by a tick, and I noticed that he was limping. And I was like, oh, he's limping. This is not good. Like obviously the puncture wound, the tick bite did something. So I was like, let me try a dose of Ledum. So I gave him one dose of Ledum 200C, stopped limping, seemed perfectly fine. And he actually developed a skin rash. He was limping on the left leg, and he actually developed a skin rash up here, which is a great sign of like something coming out. Because if you understand the direction of cure, you'll understand that skin rashes are actually a good thing. And it's the way that the body's purging and the way that the body's moving something out. So it's possible that that rash was moving something out. Both the limping resolved right away, and then the rash resolved, and he's doing great and healthy. Actually sitting in front on the floor in front of my red light therapy device panel right now, which is adorable. He loves that. But anyway, my point is that you wouldn't just give Ledum anytime there's a tick bite or a insect bite or a wound or a sting. You would want to decide if Ledum fits the picture, right? So you want to make those kind of decisions. Interestingly enough, though, I do want to share, since I've given him Ledum for that tick bite that he has not had one other tick bite, knock on wood, which is like so interesting to me. Like, how did that even come about? Like, like maybe it is prophylactically working in some way. And some homeopaths will say to do that. I'm not a big proponent of that. I will only probably treat when I will only treat when the symptoms are present, but I do think it's going to support him in the future. So here are I want you to just know the keynotes of when you would prescribe Ledum. So it's a puncture wound, you stepped on a nail, you have an something like that, right? A cat claws you in the face, right? Some sort of puncture wound. A tick bite is a puncture wound. That is a puncture going into you. It could also be another insect bite, a scorpion bite, some sort of bite, okay? Um, they can have bluish skin in the area of the bite. Like the skin could actually look blue, and it actually can be puffy and cold to touch. And there can be gouty pains. One of the symptoms that Ledum has in like the chronic cases is gouty kind of pains in joints. Um, so deep wounds could be caused by a nail or some sort of puncture, right? Animal bites, numbness and coldness around the site. It could be blue, numbness, and cold around the site. puffy, swollen. The skin could be like molted, like the color of the skin could look molted. Um, like blue and cold, but yet still feels like maybe hot to that person. So you touch it and it feels hot, but I mean cold, but to the person it feels hot, which is an interesting symptom. It will be like a tearing, throbbing pain. There can be gouting pains. Gouty pains would be more like in the chronic constitutional, person, or the chronic constitutional ledum. Pain in the feet, ankles, and soles. Again, that's more in the chronic state, or ankles that sprain really easily, more in the chronic state. Um, in the chronic state, they can act like confused, as if intoxicated, mental confusion, aversion to friends, like so desire to be alone. There could be mental confusion. This is the chronic state of ledum. But in the acute, it's more these bites, wounds, punctures, and there's an issue by it. So they are better with warmth. I'm sorry, they are hindered by warmth. They are worse with warmth and better with cold applications, just like Apis. So sometimes Apis can be hard to decipher between Ledum and Apis, but they are worse with warmth and better with cold. So they like cold applications over warm applications on the site of the injury. So that's a good keynote to pay attention to. You will have to differentiate between Apis, who also likes cold applications and usually is indicated for bites and stings, or just particularly stings. Um, Apis can be thirstless in the chronic state, where Ledum maybe not. So, but that's not really going to help you in an acute situation. You will have to differentiate between these two, and it can be challenging. Apis is not going. Apis will be swollen and red. Ledum will be more blue, and cold to the touch, where Apis will be warm to the touch. So that's a good way to help you differentiate those. Anyway, so for bites, it can calm the bite down and, relieve a septic state if possible there, reduce the swelling, help the healing, help promote the healing in a bite or a sting. It can help with gout, especially of the knees and the feet. The gout would be helped by cold applications, just like the bite or sting would be helped by cold applications. And it will feel hot to the sufferer. Yeah, so it could be a good rheumatic remedy as well. Again, worse from being overheated, especially in bed, pains and stiffness, which is better from cold. So that's Ledum. I'm gonna look if there's anything else I want to tell you about it. It's a really good, like I said, acute remedy for bites, stings, and wounds, but also a chronic rheumatism remedy for the chronic state. So that's how you want to think to use Ledum: acutely in bites and stings, or chronically in rheumatism that is better with cold applications. Um, in the mental of the chronic Ledum, they're going to be cross, so irritable, they're kind of more irritable people. Um, they may have alcoholism. They're going to be chilly, and but better with cold applications and worse from heat. So they are chilly constitution, but they are better with cold applications. So they are generally cold, but they will put cold on the elbow that has the rheumatism in it. They will want to put a cold ice pack on it. Heat will make it worse. Okay, so that's a good indication for the rheumatism. They are definitely, better from cold applications, cold bathing, general aggravation from heat, or heat in bed as well. They are chilly, but like too much heat will aggravate them as well, or like the heat of the bed will aggravate them. They are, puffy, swollen, and bloated kind of in the face, and they can have congestive headaches that are better by cold air. This is Kent. I'm looking at some books here. Kent says this is a great remedy for rheumatic heart disease as well. Of course, don't just take this remedy like because you have heart disease, it has to fit, and you definitely want to speak to a homeopath to help you with that. Rheumatism in the lower extremities, like I said before, it was good for knees and feet in the rheumatism area, particularly. Rheumatism worse from being overheated, better with cold applications. Rheumatism with pain and stiffness, which is better by cold applications. Swelling and inflamed foot and ankles, tremendous desire to put feet in cold or even ice water. Gout affecting especially the knees and the feet. So yeah, that's like the chronic case of Ledum. And this could have preceded all of this rheumatism. If rheumatism came after a tick bite, you would think of Ledum. Like if there was this picture of I've got issues with my feet and my ankles and my knees, and I have this really bad joint pain. I'm really irritable, and it's better cold applications, excuse me, worse warm applications. You would consider Ledum for sure for a rheumatism case, especially for that case in itself, but then also after a tick bite, right? Um, so gout in the knees and feet, like I mentioned. Um, I'm just looking if there's anything else. Bites and stings of insects, often with much swelling and inflammation. Puncture wounds, could be a cat bite, could be you stepped on a nail. Better with cold applications. Actually covers eczema with inflamed skin, better cold applications as well. Better cold applications is a keynote. Abscess is better with cold applications. So if they develop an abscess after a tick bite too, this could be, or just any kind of insect bite, scorpion bite, whatever, this could be something to consider. So lots of good indications for Ledum. I'm really glad I came in and chatted with you about this remedy. Good one to have in the home. Uh, for any kind of insect bites that are going to come up, or a puncture wound, or your cat scratches you, some sort of puncture wound. It actually makes me think of when I got bit by a dog. I had a really vicious dog bite attack. Oh, it was right when I was in the middle of my chronic illness journey. I was really trying to heal, and it was such a setback. I was like so upset about it because I was like, I had to take antibiotics. I didn't know about homeopathy then. I would have never taken antibiotics then if I would have known better. But anyway, the dog had punctured me. There were like punctures everywhere in my arm. Puncture from his teeth, like just long, straight punctures where the meat of, oh, sorry, my meat was actually like on the outside. And I'm wondering about this remedy. I don't remember if it was better cold applications or worse warm. I don't remember those things. Lots of remedies to consider in that case. You would absolutely consider Ledum. I would absolutely put this like on the top of the list in that situation because it was directly puncture wounds, but you'd also want to consider calendula, which I've talked about before, which is like a good homeopathic kind of like antibiotic. I would have probably dipped my arms because it was on both my arms in calendula in water, to really like or rinse the arms in calendula, a water dose. Um, and probably I've given Ledum because that would have been a good one, or Arnica for the pain as well. And there was so much swelling, so much swelling. It definitely didn't look blue, but I definitely would have considered this remedy. This would have been a good one to help support that. Anyway, I hope that that's really a helpful video that I just shared with you. I wanted to give you an idea about Ledum, and so you can know when to use it, so you can get this remedy in your home, have it. I recommend having it in a 30C and a 200C. That would probably be all you need. Um, and yeah, let me know if you have any questions, concerns, what you want to know more about. I'm putting this one on my YouTube channel, Bright Light Wellness. So thank you for tuning in there. Share it with people who need to hear it. And I'm also going to put this one on my Substack, which is Healing with Homeopathy. And follow me there if you want more like exclusive content about specifically about homeopathy. Like I mentioned, I want to do Q&As. I really want to tailor it to my followers and what they want to learn about. And I was a teacher in my past life. I was a special ed teacher for 15 years before I had my own chronic illness journey and health crisis that I went through. So teaching is a really big passion of mine. So I want to continue to foster that. So I foster that in myself because it's a passion, but then I also want to, teach people about homeopathy because I think it's so amazing and everybody should know how to use homeopathy, especially in acute situations, because if we can tackle our acutes with homeopathy, we then avoid chronic disease in the future. And I really do believe that because the suppressive medicines are what drives the pathology deeper into the body. So if we use medicine that supports healing of the body when we have acute situations, whether that's a cold, cough, flu, or a stomach virus, or a puncture wound, or an insect bite, we then up-level the health of the person and we get them stronger instead of weaker. If you want to learn more, I do have homeopathy acute courses as well. I should mention that. I have one on UTIs, kidney stones, bladder infections, all that kind of stuff, like urogenitalia, urinary tract like issues. I have one on influenza for homeopathy. I have one on ear infections, which is a tough nut to crack sometimes, but that course is really helpful. And then I have one on common childhood ailments, which covers like everything you deal with as a mom. I have a brand new one on women's health, which covers like all of your women health issues, from PMS to infertility to postpartum depression to fibroids, cysts, everything, mastitis, all the things that women deal with. I have a cell salts course, which is really great. That's just 12 remedies to learn. As a practitioner, you can really, up level your clients' health by giving them the support of cell salts, which are mineral or tissue salts that support healing in the body based on certain deficiencies. So there are lots of courses I have. You can put them in a bundle and get all of them together and really, get a comprehensive idea about how to use homeopathy. So anyway, I rambled on here a bunch. I hope you enjoyed this video about Ledum, and I will chat with you guys on the next video. Thank you for being here. Share it with somebody who you love and who needs to hear it. And yeah, thanks so much and have an incredible rest of your day. All links will be linked below for you guys.